Right. So mammary cancer is the flip side that, again, hormones do a lot of things, and the reproductive hormones do have a stimulating effect on the mammary tissue for probably obvious reasons, because having mammary development is closely tied with reproduction. You want to be able to nurse the babies. So having repeated exposure to reproductive hormones does cause repeated growth of mammary tissue, which it's supposed to do, but cancer is unchecked growth. So the more exposure you have to these hormones, the more chance you have for mutations to happen where there might then be unchecked growth, which is what the mammary cancer ends up being. And bitches are particularly prone to this because they often have false pregnancies. Even if they're not bred at all or bred and don't get pregnant, they can still exhibit a false pregnancy, which can go so far as to have mammary development, even lactation in some cases. And they'll gain weight and they'll have behavior changes, but what we're focusing on here is the mammary glands. So they can definitely develop. And actually a bitch that has the tendency to develop false pregnancies vis-a-vis the mammary glands growing, those bitches have a higher chance of mammary cancer in the future for sure.
Oh, okay.
That's been shown and published that it's not a benign condition to have a false pregnancy with mammary gland development. So if you've got a bitch that has this happen repeatedly.
Or when you're saying mammary gland development, are you talking about actually lactating or are you just saying growth?
Even just growth.
Oh,
yeah.
Okay.
Yeah, but certainly if it goes so far as lactation, then that's even farther. The more growth there is, the more chance probably that they have in the future of that switching from a benign growth to a malignant.
Because if they didn't have a false pregnancy, would there be no mammary growth?
Right.
Okay.
Yeah.
Okay.
Yeah, there are a lot of bitches that go through cycles and don't have any significant growth of their mammary tissue. That would be the normal, quote unquote,
yes.
normal.
Okay.
But I put it in quotes because it's not like it's totally abnormal there are arguments that in fact in nature we see pack animals like wolves where the sister females actually help. Everybody helps with the puppies. It's only the alpha female that gives birth, but the aunties will help take care of and sometimes even nurse the puppies. So there is a reason why dogs have developed that way and have retained in some case those traits even in domestication. So that puts them at a higher risk for mammary cancer. So early on, there was a study that was done back in the 60s that documented a higher risk for intact bitches to get mammary cancer compared to spayed bitches. But if you go back and read that original study, what they found was they reported, and this is going to be roughly what the numbers were, but it was like if a bitch is spayed before her first heat compared to after, the bitches that are spayed after one heat had like an increase of 5% chance. And then if they had 2 heats, it was like a 10% chance. And if you waited 3 heats before you spayed, then they had like a 25% greater chance of getting mammary cancer than a bitch that was spayed before her first heat. But that is not what the paper said. The paper said they had those respective increases compared to what an intact bitch would have. So that may not be obvious what I just said, the difference, but it's not like they've got a 25% chance of getting cancer. They've got a 25% higher chance of getting cancer than a bitch who's left intact. So the question is, what's the chance that a bitch that's left intact will get mammary cancer? And that answer is probably like 5%. And so what this study was showing is that a bitch that's left intact for at least 3 cycles has 25% higher than 5%. So that's like, what, a 6 or 7% chance, 6% chance compared to 5%. So it's higher, but it's not crazy higher. It's not 25% of bitches that are left intact are going to have mammary tumors. And the interesting thing is that that's been misinterpreted and mistaught since the 60s. And it's been picked up in textbooks. And so just about every vet student that goes through school learns that if you don't spay a bitch by the 3rd heat, they've got a 25% chance of getting mammary cancer.
Yes, I hear this back a lot.
And they just cite that statistic. But if you just step back and go, really? How many intact bitches do you have coming into your practice? Do 25% of them have mammary cancer eventually? Oh, no. I mean, I do see mammary cancer in intact bitches, but it's probably not 1 out of 4. No, it's not 1 out of 4. I mean, again, my clients are all breeders. All of the bitches I see just about are intact. We do not see 25% of these by the end of their lives getting mammary cancer, not even close. So yes, it's a higher risk if they're intact versus spayed to get mammary cancer, but it is not nearly as high as what has been mistaught, misinterpreted. And that's a struggle. It's frustration when you really understand what the data is. And the other thing is that, okay, if we're talking about Goldens again, who have a demonstrably higher chance of getting really awful cancers that are internal in the body, the lymph nodes, the heart, the spleen, that you can't detect until the animal's sick because it's spread and it's everywhere and it's too late to do much in most cases. Comparing that with a cancer that's on the outside of the body, in the mammary chain, that if you just have it in your mind that, well, she's a little bit higher risk for mammary cancer. I love my dog. She's an indoor dog. I'm going to pet her tummy, you know, probably more than once a week.
Right. You're going to feel something.
And just, it's in my mind. So when she's over, I'm just going to pet her and just feel. And if you do that, even as a non-veterinarian, you're going to feel a little lump that wasn't there before. And you'll catch it when it's the size of a pea. And then you'll go to your vet and you'll say, she's got a little lump in her mammary tissue. And the vet's going to go, yep, it is. Let's take that out. And then most of the time, it's going to be benign at that stage, or it's going to be completely excisable. And that little surgery, that relatively low invasive surgery, is going to be curative in that case. You know, so to me, if I'm like choosing, if I've got a golden retriever, which is obviously a great dog, right? #1 breed for years and years and years for good reason. It's a great family dog. Lots of reasons to have a golden retriever. Well, I know that I'm getting a dog that has a chance of getting cancer higher than other breeds. I'm definitely going to mitigate that by not putting her at higher risk by taking her ovaries out. And then knowing that now I've got to watch for, if I leave her completely intact, pyometra. And if I just leave ovaries, I still have to worry about mammary cancer, but I can worry about mammary cancer.
Right.
I can pet her belly rub.
Okay. That was what I was going to ask you. So you answered. I mean, that's exactly right.